Going not too far back, maybe about a decade or so, we've had major advances in hemophilia therapy. The first one was with regard to the introduction of extended half-life products. What this did was to change the paradigm of trying to achieve 1% trough levels on prophylaxis to a much higher 3 to 5%, and that too with less frequent injections. So this really transformed the way in which people with hemophilia could indulge in more leisure activities where they had to be less careful because of fear of bleeding. Now, what came next was the non-factor therapies, and the first one in the market is Emicizumab, which provides a hemostasis level of almost 10 to 15% of factor VIII. So now the trough has changed from less than 1 to 3 to 5, and now we are looking at 10 to 15, where these people can live almost normally even with contact sports. So that group of drugs and many more are in the pipeline would really change the way these people live and reduce the treatment burden, particularly when we have drugs like Fitusiran that will be given just 6 to 12 times in a year subcutaneously. And finally, we now have gene therapy on the horizon. It's very likely that we'll have a product approval soon. That's looking at cure of the disease, at least in terms of giving functionally safe factor levels, if not normal levels. Whether that product will be used widely will depend, of course, on what the cost of the product is going to be, and that is something to watch for. But the last decade has really transformed the management of hemophilia like it had never been before.